طيب نحن لايف على اليوتيوب الحين.
مم.
بس ننتظر كم دقيقة لبعض المشاركين إنه نبدأ إن شاء الله.
MashaAllah, you have really good number. Can you reach more than 50?
كيف ذا دكتور؟ ما سمعت.
I said you really reach a good number. You reach up more than 50 participants, which is really interesting.
Yeah, and I hope more will come because it's supposed to be maybe 100 and more.
Wow.
واضحة؟
Yes.
ما أشوفني.
Okay, started all to join. So أحمد shall we start?
يلا نبدأ.
يلا.
بس سامي إذا تقدر تسوي سبوت لايت للدكتور
أيوة سويت.
يبدأ الشرح. أوكي.
سويت تمام.
Okay, we can start.
أوكي. بسم الله، السلام عليكم.
عليكم السلام.
Good morning. أقولكم أرحب بالدكتور أو خلاص داخلين البارتيسيبنت كامل؟
ابتدي.
أيوة رحبي بالدكتور.
Okay. Good morning and welcome to everybody. It's my pleasure to introduce Dr. Ahmed Al-Ghaythi, an orthopedic surgeon at Sahar Hospital, to fill us in on the latest news of artificial intelligence usage in relation to musculoskeletal system. Before we start, I'd like to ask the audience that if you have any question or doubt, please write it down on chat. And when the presentation is over, Dr. Ahmed will discuss them with you. So, Dr. Ahmed, welcome and you can start.
Thank you a lot, Asma. Just mild change. I am no more belong to Sahar Hospital. I am staff of Sultan Qaboos University now. Okay, so I just joined a couple of days back. Okay, so sure, no issues. So usually I don't give long talks because people will start to be boring and they will not be interested in the end. So my talk will be concise and to make it more interactive for you guys and to make it for you to understand and if you want to ask any questions in the end. So the talk is about artificial intelligence and musculoskeletal imaging. So this talk was initiated since we started the small project with a collaboration of people from Sultan Qaboos University, the Industrial Innovation Center, and Rosail, if you heard about it, it's just a part of the Research Council. So thanks to Asma and Mariam and the other guys who reached me and invited me for this talk. So to start with them as an outline, I'll give you a small introduction about artificial intelligence in medicine. Then we'll go to some technical aspects, then application from people who try to apply artificial intelligence in musculoskeletal imaging. Then we will go to small brief about the study we started to go for some for the artificial intelligence, and we try to apply these in our daily practice. Of course, you have invited Dr. Zaid and the other guys who try to do it in Royal Hospital and SQ and College of Engineers and College of Medicine even, but this is the first initiative outside Sultan Qaboos University and outside Muscat. So as an introduction, when you guys graduate and you sit up in a hospital or an emergency department or in a health center, especially in a remote area, if any patient comes to you and he complains of pain from his limbs, and you will have 100%, you will be encountering this issue, because most of this patients comes to the emergency department and family medicine clinics. They are more than 50% of the patients. So you will ask for an X-ray as a start. So to read this X-ray, the reading in an X-ray is really an art. You have to excel on it. Otherwise, you will fail in making the diagnosis and making the accurate diagnosis. So, and this is what really happens. So most of the errors which happen in the emergency department and the family clinics is due to a human factor, most probably, because either the reading from the physician is he's young and he's not having that much experience to read that an X-ray, or he's tired, especially if you're even a senior consultant or a professional radiology. After a long day, he will have some error in reading this in reading these images. So this is why people thought about artificial intelligence to be like to solve this issue for them. However, the previous models of the artificial intelligence was very primitive, so it was not able to fulfill these needs. But with the development of the artificial intelligence and the neural networks, they started to get more accurate algorithms and modules, which made a paradigmal shift in the ability of the system and the computer to detect, characterize, and even diagnose complex pathologies and musculoskeletal tissues. So you already, I think most of you already knows this, like an artificial intelligence is the whole group taking as a machine learning is a subfield of artificial intelligence, and the deep learning and the convolutional neural networks are part of this machine learning. So the new deep learning have helped since the 2010 and above in doing and applying the AI in musculoskeletal diagnosis. So what can AI do for us? It can detect the abnormality, for example, a fracture or a pathology in a patient who's chronic pain like a tumor, or even very congenital issues like Burt's diseases and other stuff and even traumatic injuries to the hips of small children, like scabies and other stuff like this. So people still afraid when you tell them about artificial intelligence, applying them to medicine, especially some of the old people, especially even here in Oman. Like when we introduce this concept to them, some of the radiologists, histopathologists, even the orthopedic surgeon, they say, if the artificial intelligence and the system does our work, what we will do. You don't think about it in this way. You should think of artificial intelligence as a complement and for our work to optimize the workflow in our clinical setting, rather than the pure replacement of our existence in the hospitals. So how it can help? It should increase the speed to provide a report for most of the urgent cases. Like when you are facing a patient with a trauma patient in the hospital with an MVC, so it can give you an more accurate diagnosis and report for the patients, and even before the radiologist comes and report it to you. So it will improve the quality of your image interpretation. And if you are like, for example, before, I don't think this is the current practice nowadays, but it is there in other countries. So when people graduate, they will shift them to a health center. Then when they go to the health centers, they will be alone. They just graduated from medical school and they don't know how to read these images. So this can help these people and these doctors and practicing physicians in interpreting this type of imaging they are asking for. So what are the examples we have in AI application? We have like fracture detection, degenerative change in detection, grading of these changes, looking into fragility of the bone. Like the current practice is when you face an old lady or an old man and you want to detect the score for him to be so he will be susceptible for fragility fractures. He will we do usually bone marrow density. But with the AI application, there are multiple people and many people and researchers try to even detect it from X-rays, from CT scans, from MRI. You don't need to do really a bone marrow density, because when you do bone marrow density, you are really exposing the patient to a lot of radiations. And of course, it can also help you in detecting the age of the patient. So like, you wonder why you want to know the age of the patient. Some of the practice in MSK, patients comes with the different congenital deformities, and these they are not represented with their real age. So the bone age is different from their age really. So this can help, and the AI can help in this also. So let's go to this application. Well, I'll give you just a brief about them. I'll not go in very extensive how they did it, but to give you the flavor how they what they are researchers trying to do. So, like for example, Yurukawa and his colleagues try to train a model in how to diagnose hip fractures. So for you guys, like looking at this image, this is the normal X-ray, the normal side of the patients. This is the abnormal side of the patients. If you are, even for experienced orthopedic surgeon or radiologist, if he's in the really late day or very exhausted, this is a very subtle fracture. It can really difficult to diagnose. So they trained a model and they detected the accuracy of it, and they show their accuracy of their system. What they trained their model to do is more accurate even for orthopedic surgeons. So the experienced surgeons was 88.3, where their models reached to up to 95% accuracy compared to like to the orthopedic surgeon. So this is a really a good application, but still you cannot take it to clinical practice. Most of the all of these applications that I'm presenting, still they are in primitive stage. They cannot, they didn't go into full clinical trials to detect the real accuracy. But this is the initial result that what they showed. Then another group, this is one of the largest group. They took large data and x-rays of hands, wrists, and ankles, and they try to detect fractures. Their algorithm was a bit different from the others, like they are looking into the integrity of the cortices of the fracture of the bone, and if there is the integrity deficit is there, it goes to into a fracture. And they compared to orthopedic surgeon, of course, and the accuracy was almost the same as it was like for orthopedic surgeons, which is 83% comparing to humans. Then they send this data was open for everybody, for researchers online. Even you guys, you can access these data. And a lot of researchers, they try to use their data, and what they got later on, they got better accuracy in the module that they trained. So each guy put a different module, put a different algorithm, a computer in a different coding system way, and he gets different accuracy. So there was later published papers in the same data which showed more accurate results than the initial Jacob and his friends. Also, Kim did the same for distal radius, and he got a sensitivity of 90%, a specificity of 80% in detecting the fractures. Of course, you know, guys, when you train a module, they divide and they split their data into different categories: 80% for training, 10% for testing, and 10% the related 10% for the accuracy detection. So this is why they split their data. So that was for the fracture detection. We will go now for another entity. What they are looking for, other researchers, they went to degenerative changes, hip osteoarthritis. So you can see most of the people here, what they are, who are trying to do this, they are from the from the Eastern countries, the Asians, especially the Chinese. They are the ones who are more active in this part. So this group, they trained a module and to detect osteoarthritic changes. So if you look into the hip X-ray, you see this is the normal surface area of the hip. But if you go into this X-ray, you notice some changes, some sclerotic changes, some osteophytes. You guys know what I mean by osteophytes. So they trained the module to detect this accuracy, how much the system can detect the accuracy of these changes. And they found really a good accuracy percentage, which reached up to 92%. Another group, they went to degenerative changes of the knee. And this group, even they went to a classification, a grading of the changes. So the accuracy was also high. So they have seen that how much is the grade of the osteoarthritic changes from grade 1, which is almost normal knee, to a grade 4, which is very high changes, which was really, the result was almost comparable to human readers. So I told you about the bone fragility. This is one of the groups who try to do this, an MRI. So they don't want to expose the patient for high dose of an X-rays, like when we do BMT, the bone marrow density. So they did it in an MRI. What they found that there was different groups here. You can young hoppers and berries. All of them, they try to do this, and they got really good promising results on this. Here, when I was talking about when you detect the age of the patients, so if you go from early stages of childhood to puberty, then like full maturity, you can see the ossification of the bones differs. So with this, they try to do it, and they got really good accuracy looking into how much they found the patient, the age of the patients. Another group try to assess the integrity of knees. So one of the most common problem in the orthopedic surgery is, especially for the boys, when you play football, you will injure your ACL, anterior cruciate ligaments, your meniscus. Then they try to train this system to get really a good accuracy of what they did, but it was even difficult for them. We tried to do this also in the beginning, but we failed, and we couldn't do it really. So we skipped the knees, and we tried to go for the spines, because the knee is very complex, and the ligaments and the meniscus, the chondral surface, it's very fade. And when you train your system in something like this, the color contrast makes a big difference. And this is why even this group was not really getting a good results in their detection of these pathologies. So you see, guys, this is really a growing in the literature, and people trying to apply this in diagnosing, in classifying, and leading, helping them in the treatment. But still, the literature is still insufficient and still unraised. So I'll give you a flavor of what we did in Suhar Hospital when I was there, with a collaboration with Prof. Thomas Gabriel and with Dr. Yasser, who was the HOD of the Department of Radiology. So guys, do you want me to continue, or want to take a break or something? Hello?
Doctor, you can continue. You have like 4 minutes, then we will take a break.
Okay, sure. Because if you want me to continue in this, this is the other part of it. So if I continue, it will take me like 10 minutes more. So if you want to take a break now, it's better than we continue this later. It's up to you.
Yeah.
So break.
So yeah, I think it's okay. Let's take a water break for all. Stay hydrated. Just 1 minute. Go drink water and come back.
So, shall we start?
Yes, doctor, we can start again now.
Okay, fine. So we try to apply the AI in the lumbosacral MRIs. It's a very common pathology. You all of you will encounter this. Patient will come with a back pain. You want to do first an X-ray for him. The X-ray most probably will not show anything. Then you will go for the MRI. Interpreting an MRI of lumbosacral spine is a very complex one, and you need to know all the anatomy and what type of the pathology you are expecting, and patients usually will present with a subtle changes. So with this initiative, it's not moving, yes. As a statement, we don't declare any conflict of interest. There was no external fund for this thing. However, the proceeding thing was funded by the Research Council. So, as I told you, it is a standard of care when you do an MRI for patients. It demonstrates high accuracy of diagnosis of spinal degenerative changes and discopathy. And the quantity of details is very huge. And even for a board-certified musculoskeletal radiologist, it's really a difficult task for them. So, why this study was done? To see if we can apply the deep learning module and can succeed in clinically important tasks for detecting disorders in the lumbosacral spine, and is it going to get a better accuracy compared to the humans, and later on to apply it in clinical practice. So we collected something like an 80 MRI for this pilot study, and we manually reviewed all the MRI, and we detected all the pathological areas, and we trained the module to do this. So the MRIs this is of course the MRI, and of course you have to treat these images, because when you get the image from the system, it will have a lot of like written things here and there. So we have to treat them and to take off all the written things from the images. We took 1.5 Tesla magnetic fields, which is the standard of care, and we only apply it for the sagittal cuts. You know, guys, there is a sagittal cuts, a coronal cuts, and so we in this pilot was only in the sagittal cuts. The images for each number it was ranging from 3 to 5 per patient, and we split them to 70 as training, 15 as validation, and 15 for testing. The common neural networks, we use the Google Net architecture, and it was like, if you go to more details, you will find some layers and stuff like this, connection, layers, nodes. This is more for the engineers who did it for us. It's 144 layers, 170 connections. And what we did is we were looking for a very specific thing, because we were trying to see if this is going to be really succeeding with this or not. So you can see in the right side of the image is like, this is the normal MRI, and you can see the good shaped vertebra with the disc all over, the color contrast between them, the white shiny spinal cord. In contrast to the abnormal one on the left side, you can see the disc changes here, the decrease in space, the decrease in the color contrast between the two, between this and this. then the effacement, what we call it, effacement and compression on the neural tube. So this is mostly what we are looking for, the change of the disk space, the disk height, and in the code compression, how much was the code compressed. And it was really a succeeding thing. We got an accuracy of reaching up to 90%. So the system, our system was reaching the really high accuracy in detecting this. So what does this mean? So it means the deep learning, the algorithm we did is really a good, and it has a really potential to for as a primary result, as a proof of concept for these patients, for this pathology, but and it can improve the access to quality MRI diagnosis in the absence of the specialist radiologist. And of course, you can augment it if you have a specialist radiologist, you can augment them with this module. But still, our result is primitive, and still it's just a pilot study. It's only an 80 images, 80 studies. And if you multiply them into 3 to 5, and you will end up with something like 100+ images. So as a conclusion, we had an AI has significant potential to be successful tool in the diagnosis of musculoskeletal pathologies. And it's really a promising technology, but still we don't have a sufficient enough proof to take it into the clinical practice. As people always say, artificial intelligence is still far away from the hospital. We are still have a long journey to do till we reach to a clinical application. All the people, what they are doing currently for artificial intelligence, even the people in Royal Hospital, what they do in breast diagnosis, still is like a complementary work, what they do with the radiologists and stuff like this. So this was to give you just only a flavor of how AI can be applied in the musculoskeletal diagnosis. So thank you a lot. If any question, I'm really happy to answer.
Yes, doctor, there was some questions from the audience. You can choose question and answer.
Is the chat. So Lujain, I don't know how to read the name. Al-Ma'mari. So Lujain. How far? Lujaina, yes?
Yes.
How far we are in AI in Oman? To be honest, we are lagging a lot in application of AI in medical field, and this is because of a lot of restriction, a lot of funding issues, and to convince evil people and accepting this thing. Like when we try to host a meeting to start this project, we faced a lot of obstacles from Ministry of Health, from the Sultan Qaboos University even. So we are really still not in a good, we are in the track, but compared to the others, we are lagging behind. Yamama, can AI successfully distinguish artifact presented in those radiographs images? Okay, so this is very technical aspect. Yes, if you train your model and you do your coding in proper way, the system will not look into the artifacts. It will look into the pathology only. So it depends on how accurate and how much is your system your algorithm was coded. So this is very, very technical aspect. this is why, like, when you do it in like only in 80 studies, it's not enough to say this is an accurate, this is the real accuracy what we got. So we have to have it in more bigger number of patients and studies. Tariq Al-Habsi, are you working on other MRI other than lumbar spine currently? For now, we, as said, we try to apply it for other modalities like MRI of knee. We had real difficulty in doing that, and the accuracy was very, very poor. So we are restricting our work nowadays is in the lumbar spine MRI, yes. You can see more questions coming. May, what are the possible risks and excessive usage of AI in the medical field? There are risks, and of course, in any application you do, the system will have an error, of course. This is why we don't reach up to 100% accuracy. So when you do it, is you have to take care of your results. So take care when you do it. Can AI replace radiologists entirely in the future? This is a very, very long talk and very debating issue. You can, even if you guys just open the YouTube and search this, even people who are trying to go into radiology as a subspecialty when they finish the medical school, they have concern nowadays regarding this issue. But I'm telling you, still, it is very, very early to say the system can replace the human. It can augment the human work, but still, no, you cannot. AI, Tariq Al-Habsi again asking, AI project from breast cancer was presented yesterday by Dr. Zahid, and it was implementing a routine hospital, including Royal Hospital. Do you think collaboration between teams to facilitate the growth of AI in Oman? See, Tariq is like a collaborating, yes, it's a good thing, but and what they are applying already in the 3 hospitals still in the initial trials. So to collaborate with them, their field is different for now. So for example, when they do this, their coding and algorithm, when you train your system, is a bit different from their X-ray, from for them radiological investigation from ours. So yes, it's a good to collaborate with people, but you need to know the restrictions and what the limitation, how much you can do as a collaboration. So we always open for collaborations, and I don't think you guys know me much, but if you ask about me, you'll find me doing a lot of collaboration from here and there. This is why you can find my collaboration even outside the country. And even it's not just an AI and other stuff like regenerative medicine. Nowadays we are working in Sultan Qaboos University, and we are hiring groups, people from Ministry of Health and from other universities like University of Nazwa, even back from Sahar people when I was there. So collaboration is a good option, but the collaboration needs to be tailored to what you are doing. So I think that's it for the questions.
Okay. Thank you, Dr. Ahmed, for great information you shared with us.
Thank you a lot. It was my pleasure to be with you guys and just to give you the flavor of what we are doing and what are the possible potentials. Thank you a lot.
Thank you for all listeners.
Thank you a lot. Thank you, guys.